Dr. Jameson had seen his fair share of dental emergencies throughout his career, but the sight that greeted him as he walked into the treatment room that day left him utterly perplexed. Sitting in the dental chair was a young woman, her face contorted in pain, with lips so red they seemed to be on the brink of bursting wide open. This was a sight he had never encountered before, and curiosity mingled with concern as he approached her. As he donned his gloves and prepared to examine the patient, Dr. Jameson couldn't help but wonder what could have caused such a bizarre and agonizing condition. The woman's lips were swollen, inflamed, and seemed to pulsate with each passing second. She winced in pain as she attempted to speak, her voice barely a whisper. "What happened to your lips?" Dr. Jameson asked, his voice filled with genuine concern. The patient, Sarah, mustered all her strength to reply, her words coming out in strained bursts. "I woke up this morning, and they were like this. It feels like they're on fire, and the pain is unbearable." Dr. Jameson nodded sympathetically, his mind racing to find a possible explanation for this unusual condition. He examined Sarah's mouth carefully, searching for any signs of infection or injury, but found nothing out of the ordinary. Her teeth and gums appeared healthy, leaving him puzzled and intrigued. Determined to help his patient, Dr. Jameson decided to delve deeper into Sarah's medical history. He asked her about any recent changes in her lifestyle, diet, or medication. Sarah shook her head weakly, unable to provide any useful information. As he continued to investigate, Dr. Jameson couldn't help but consider the possibility of an allergic reaction. Could Sarah have come into contact with something that triggered such a severe response? He asked her about any new cosmetics, foods, or environmental factors she had encountered in the past few days. Sarah's eyes widened, and she suddenly remembered something that might hold the key to her suffering. "I recently bought this new lipstick," she whispered, her voice filled with a mix of hope and worry. "It was a limited edition shade, and I thought it would be perfect for a special occasion." Dr. Jameson's eyes lit up with newfound understanding. He had heard of cases where individuals developed allergic reactions to certain cosmetic products, but never to this extent. He asked Sarah to bring the lipstick to her next appointment, hoping it would provide a crucial clue. Days later, Sarah returned to Dr. Jameson's office, clutching the offending lipstick tube in her hand. Her lips were still swollen, but the pain had subsided slightly since her last visit. Dr. Jameson carefully examined the lipstick, analyzing its ingredients and cross-referencing them with known allergens. To his surprise, he discovered that the lipstick contained a rare, highly potent dye derived from an exotic flower. It was known to cause severe allergic reactions in some individuals, but never to this degree. Driven by his determination to help Sarah, Dr. Jameson contacted a renowned allergist to explore potential treatment options. Together, they formulated a specialized treatment plan to alleviate Sarah's symptoms and gradually reverse the allergic reaction. It was a long and arduous process, but Sarah's resilience and Dr. Jameson's unwavering dedication paid off. Slowly but surely, her lips returned to their normal state, and the pain dissipated. News of this extraordinary case spread throughout the dental community, and Dr. Jameson became known as the dentist who unraveled the mystery of the painful red lips. From that day forward, he approached every patient with an even greater sense of curiosity and empathy, knowing that sometimes the most perplexing cases could lead to the most remarkable discoveries.